let's talk about exercise after you've had your baby. Is exercise safe? When should you actually start exercise? What are the best time frames for that? Well, first we need to talk about how your body changed with the delivery. We talked before about pregnancy. Some of those changes are still in effect. And now after you've delivered, what does your body feel like? There are a lot of changes for you, not just your stomach and your pelvic floor, but you're actually probably not having as much sleep as you usually do. So you're a little bit fatigued. You also don't have as much time for yourself. So maybe in the past, if you weren't caught up on sleep, you were able to kind of recover in off times, but usually you're taking care of the little one right now. So lack of me time is a consideration. If you're breastfeeding or pumping, your nutrients do go to the baby first. So maybe your nutrients are a little bit different. Make sure you're getting enough good substance to feed both you and your baby. You also probably have a bit more effort than you did before pregnancy. Even though you're not carrying the baby any longer, you probably put on a little bit of weight during pregnancy, and so that makes it harder to move generally. And you're also probably not as in shape or deconditioned as you were before having the baby. Ask yourself, how many months has it been since you exercised the way that you want to? If it's been a really long time, then it's probably going to take a little bit longer for you to get back to your normal. So these are all things to consider. And overall, you're probably just feeling fatigued faster. Now, these are not reasons to say, oh my gosh, I should never exercise. Look at all these things going wrong with me. These are reasons to just kind of give yourself that permission that it's not going to happen right away. It might take a little bit longer for you to get back than you're wanting it to. Other ways that your body changed after delivery, your hips and your ribs are a little bit different, right? So the rib cage could be a little bit wider and sometimes tilted back a little bit because you were accommodating the baby if you carried really high. And your abdominal muscles may be a little bit stretched out. Not maybe, they are, and they still are after delivery. It takes some time for them to come back. Your pelvic floor muscles are stretched. Even if you had a C-section, they are a little bit more stretched than they were prior to pregnancy, and certainly with vaginal delivery, they've definitely been stretched. And again, your joints don't just all of a sudden become really nice and stiff after you've delivered. It takes time for those hormones to change. Your ligaments are still loosey-goosey even after delivery. And your pelvic floor itself, like I said, is stretched out, so it's actually a little bit wider than it was prior to the delivery. What are the actual time frames for getting back to being yourself? This is a great question. Some ladies ask, why is 6 weeks this important time frame? Why does everything start at 6 weeks? Well, one really important change is that your uterus is back to its normal size between 6 and 8 weeks. So that's one reason that the time frame of 6 weeks is one that you'll hear of a lot. You'll have the majority of your healing for scars is happening at around 6 to 8 weeks. So the incision should be closed, whether it's a C-section, an episiotomy, or a perineal repair. So if you had a tear and they repaired it, those wounds have been healed at around 6 to 8 weeks. So while the incision is closed and healed, it's still not as strong as it's going to be. This is still delicate closure. So maybe your muscles are ready to start engaging. Muscle strength is one thing we all understand pretty well, but the wound strength is different. So that means that it's closed, it's healing, it's doing what it's supposed to, but it's not that strong yet. You still only have 50% of that tensile strength of the closure at around 6 to 8 weeks. At 3 months postpartum, you have quite a bit more strength of that closure. So the wound has healed and it continues to heal, and you're at about 70% strength at 3 months. At 6 months postpartum, you're at 80 to 93% of tensile strength. So you're feeling pretty good to go. Whether you had a C-section or a significant vaginal repair, that 6-month time frame, you really have that strength that you have nothing to do with. It's not your muscles. It's just that closure is really solid at that point in time. So it's a great time to springboard into higher level activities. And the final thing is that the actual pelvic floor itself, there's a measurement that they take from the pubic bone all the way to where the muscle loops around the anal canal. And that space gets bigger after delivery. And we know that that space comes back to mostly normal by 6 months, continues to improve all the way up to a year. And the interesting thing is that this is still true for C-sections. So even if you did not have a vaginal delivery, that pelvic floor is coming back to its normal size all the way up to a year postpartum. So these are all reasons that it is okay to modify your exercises in the beginning, especially those first 6 weeks, first 3 months. We really want to modify as necessary. And then as you're feeling stronger, more secure with your activities, and you have less symptoms, then that's when you should definitely ramp it up. So when should you be careful with exercise? Of course, there are times that we need to be careful with what you are getting back to. So my first tip is just to start gradually. Don't jump into something emotionally. You might be there, you might be really ready to go, but your body is maybe a little bit slower to get back to that. So start gradually and build your load up progressively. Start with exercises that you're familiar with. We actually know that the pelvic floor pressure is less on exercises that you really know well. So if you're trying to choose what should I get back to, I recommend that you get back to what you know and what you're really good at. Your body will be comfortable with that. It still might feel a little different than you're used to, but overall you're going to have less pelvic floor pressure with exercises you're familiar with, rather than going to the gym and trying a new class every day. That might be pretty stressful for your pelvic floor and that first 3 months. Definitely eat enough to meet your caloric needs. So when you're exercising, think about how many calories you're expending and make sure you're eating enough for you and your baby. And then it's great to wear support garments. So sports bras, if you're nursing, are really important. Go ahead and pump prior to exercise. It will be a lot more comfortable. Some ladies in that first 3 months still may need to use a belly band to get back into some exercises, and that's definitely okay. After the 3-month time frame, you should be past that, but it's great, especially for 6 weeks, definitely. One of the most important things when you are exercising, especially in the beginning, is that if you see any increase in vaginal bleeding, you should stop exercise and talk to your OB or midwife about that. And change your exercise if it's causing other problems like urinary leakage, the sensation of heaviness in the pelvic area, or any sort of joint pain. So those are not reasons to stop exercise, but those are reasons to change them. See if there's a different modification that you can do so you can still get your cardio in and you can still get your strength training in. Some basic ideas for what you should do with exercise. The first thing is really avoid bearing down. So when you exercise with lifting weights, for example, you really want to make sure that you're lifting that pressure up and away from your pelvis. So we really can learn to control the direction of pressure when we exercise. So ask yourself, when I contract my core, where do I feel that pressure? Start to think about that. If you feel it pushing down, that's extremely common after you've been pregnant. So your lower abdomen is usually pretty overstretched, especially after baby 2 plus. So your upper abs, most of the time I see with postpartum ladies that their upper abs are pretty good. They've been working at it. They've been doing their core exercises. They come, they show me those obliques and upper abs, man, they fire, and it's really great. And then you see this big poof in the lower belly. So the lower abdominal muscles were overstretched, and sometimes we just need to tell them to work. They've been overstretched, so they're not used to working again. So you actually need to think about drawing your lower abs in and lifting them up with your muscles to prevent pressure from moving down. So again, if you just use your upper abdomen, think of a balloon here. If I just squeeze the upper abdomen, it's going to kind of balloon down into my lower belly and my pelvic floor. But if I include my lower abs and my upper abs, and then eventually also my pelvic floor, then that pressure is really lifting and supporting my organs, and I can feel the pressure moving up, not pushing down. So try to avoid bearing down when you're exercising. Breathing naturally is kind of helpful for that too. Of course, if you're lifting heavy, you're going to have a stronger brace, but you should still include your lower abdomen and your pelvic floor. And I would propose just lift as heavy as you're capable of lifting with those two muscle groups engaged. And of course, you will build your load, your tolerance over time, but be mindful of where your pressures are. Work in a lot of different positions. So a lot of times we just see pictures of ladies lying on their back doing leg lifts when they're first starting out with core exercises. That is fantastic to get started with, but at the same time you can do side lying exercises, you can do some standing leg motion exercises, hands and knees. So just try different positions with engaging your core in those different positions, not just on your back. And then you should also progress to engaging your core with normal activities. So let's say you're emptying the dishwasher. Can you engage your core for some of those motions? When you're walking around, can you engage your core for some of those motions? All right, you're in your first 2 weeks after you had the baby. What can you do? You are so ready to get back to you. Some people have no desire to do any exercise at this time frame, and some people just want to get out there immediately. So my recommendation to you is you are only 0 to 2 weeks postpartum. Take some time, snuggle the baby, get good nutrition, good rest, and walking is your mainstay for exercise. Walking is really important, whether you had a C-section or a vaginal delivery. That's really your most important exercise in that 0 to 2 week time frame. Now, if you really want to get moving and try something else and you feel good with these exercises and you want to do these, then there are some things that you can start in those first 2 weeks. The first exercise is pelvic tilts and rib tilts. I put those in the same category. It's really just working on your posture. The second one is Kegels. If you had an uncomplicated delivery and you don't have any pain with a Kegel, then you definitely can go ahead and start Kegels or pelvic floor muscle contractions. And then you can activate your deep abdomen by just trying to lift and hold your belly. That's how you activate that deep transverse abdomen, and then rest. And try to see, can you do that while breathing normally? And then the fourth one is the pelvic brace, and that's where you lift and engage your abdomen and you add in the pelvic floor. Again, 0 to 2 weeks after having a baby, this could be pretty difficult for a lot of ladies, but as long as you have no pain and problem with it, you are welcome to do this activity. And then diaphragmatic breathing, so that's where you just take a really big breath in, let your stomach expand, your pelvic floor expand on the inhale. As you exhale, feel them both come back to normal, and then exaggerate that exhale, and you should feel your deep abdomen and your pelvic floor contract a little bit. Just want to repeat, if you have any discomfort with this, including with a C-section or a vaginal repair or perineal repair, then this is not the time to work on these exercises. So here is a picture of doing the pelvic tilts. So you can just lie on your back. You don't want to use your abs with this at all. Imagine there's a clock on your pelvis, and you're going to tilt your pelvis back. Your back will go flat onto the ground, and it's like you're tilting back to that 12 o'clock position. You can just hold this for 10 seconds while breathing normally. This helps with a lot of postural changes that happen during pregnancy, helps your spine, helps your core. It's a fantastic exercise to get started with. Once you feel like this is easy lying down, you can try this in sitting. You can even try this in standing. It's pretty challenging, but you can. You can try this in kneeling, lots of different positions to just get your body back to a new normal. The second exercise is Kegels. We talked about these a little bit in the past. So you can get started postpartum, just simply contract and let go. You don't really need to worry about how to get it super strong right now. You're just getting circulation to the area for the most part. So just gentle and pain-free contraction and then release. When you do these exercises, make sure you're not moving anything else. So your muscles are probably pretty weak. So sometimes your brain wants to feel something really strong. So you'll start squeezing your legs or squeezing your belly or squeezing your glutes. Just remember that the pelvic floor muscles are not your legs, they are not your stomach, they are not your glutes. You just want to isolate the muscles in between the pubic bone, in between the legs. You should not feel anything else contracting when you're contracting the pelvic floor. So the third exercise is the transverse abdominal muscle activation. So this lady is not 0 to 2 weeks postpartum. She's quite a bit further out than that, but you can kind of see on her abdomen that when she's contracting, by just pushing air into her stomach, you see the stomach rise, and there's a little bit of a tenting in the middle of her abdomen. But when she draws up and in with that nice tensioning of her midline, then there's a flattening. So as soon as you're ready to start core exercises, try to learn them the right way. So get your alignment right, pelvic tilts and rib tilts, and then draw your lower abdomen, your belly button in towards your spine and up towards your rib cage, and see that it goes flat, feel that it goes flat. That's the right way to activate your core. So the pelvic brace is very similar to activating the transversus abdominis muscles, but now you're going to also include contracting your pelvic floor. So drawing in the lower abdomen and then fine-tuning that closure or that support to the abdomen with a pelvic floor contraction. But being able to do this while breathing normally is important. So this is a motor skill or a new technique to practice. So it's intentionally easy in the beginning so that you really get your foundation correct before we start scaling up. So the pelvic brace includes your lower abdomen, your pelvic floor, and being able to breathe easily. And then finally, the diaphragmatic breath. That's the inhale, skip your rib cage. The lower ribs can expand, your belly expands, pelvic floor expands and drops. As you exhale, everything comes back to normal. Keep exhaling, exaggerate that exhale, and feel your deep abdomen and deep pelvic floor start to lift and engage. So exercises starting at 6 weeks to 12 weeks. We now include both people with C-sections that have been cleared by their OB or midwife, and ladies who had a vaginal delivery. So first, let's talk about the ladies who've had a C-section. What would be different for you? Let's remember that your healing time frame is pretty important. So you just now have closure of your abdominal muscles. So while you've been cleared to start exercising, I do not recommend going straight into aggressive exercises. Maybe your muscles are ready for that, but that connection's not quite ready for that yet. So slow, gradual, progressive is the way to recover faster and better so you do not have any setbacks. And around 6 to 7 months, that's when you're going to really feel a lot stronger. So often ladies tell me they just feel weak. Well, that's one of the reasons. Even though your muscles are gaining strength, that connective tissue is not quite as strong until that 6-month time frame. So just continue building your strength progressively. One of my favorite exercises to teach the lower abdomen how to work, this is fantastic for C-sections or for ladies that have had several pregnancies and that lower abdomen is just super overstretched and they can't figure out how to get it to work. So lying on your back with your feet flat on the ground, get a stability ball, one of those giant yoga balls, and with a straight arm, just push straight into your knees. As you're doing that, you pull your stomach in and it tightens, and it's just really great at making the lower abdomen wake up. So I like this exercise in the beginning just to teach those lower abs where they are, connect with your brain on how to contract them. So hold for 10 seconds, repeat it 10 times, and make sure you can breathe while you're holding this contraction. All right, so other exercises that you can start doing between weeks 7 and 12. The answer is you can do whatever you feel good doing. Just start slow. I do recommend you start with low impact exercises first. So power walking, seated cycling if that's not painful to sit on a saddle. Those are really great for pelvic floor support and for building your cardio and just getting the body used to exercise again. Increase your distance before you increase your intensity. So generally speaking, that's a good way for the body to adapt. Deadlift techniques, beginning with light weights, no more than the weight of a baby inside of a car seat, and then gradually progress your load. So for example, you could start with a barbell only, see how your body feels, really make sure your alignment is good. It's going to be very different lifting after you delivered than it was before. If you feel solid, your alignment's good, you have a buddy who knows how to see your alignment, then you can feel good progressing a little bit faster if you are a weightlifter and you have a good history of training. Otherwise, just start slow and build appropriately. For resistance training, you can start with TheraBands or cables or light free weights, and then just progress it until it feels a little bit more challenging. If you'd like to return to running before 3 months postpartum, our new recommendation really is the time frame is 3 months. But if you would like to return to running before that, then please go forward to the Return to Run section. There is a self-test that you can check out. If there's a pelvic floor therapist available, they can screen you for this. But for most people, you can do the screen on your own. So some exercise modification options. This is an example of doing a squat to a higher surface. Maybe you have a plyo box, or if you are at home because you can't leave the house, there's just too much to do. You can actually use the edge of the couch. The armrest is a great height to just get started with some squats. So in this picture, she is doing a squat, and she's demonstrating on the left, tucking her tail under, kind of that flat back. That's the position that's not very supportive for your pelvic floor. So the better position is to have a neutral spine and to squat as far as you can, keeping that spine neutral. So I usually tell people, go ahead and try a fold-up squat and have someone watch you from the side or video you from the side. And then as soon as you see that your tail is tucking under, that's too far. So you're going to start training only to the depth that you can move with keeping your pelvis neutral. And you can feel safe adding load in that position as long as your alignment is good. Some other modifications that I recommend if you are trying to get back to push-ups and planks, you can actually start pretty soon. So in that 6-week time frame, you could even start up on the wall. So you could do wall push-ups and wall planks. Just feel the engagement of your abdomen. You don't really have to hold your pelvic floor in that position. It's too long to hold the pelvic floor, but you should feel your abdomen engage. You should not feel pressure down into the pelvis. If you do, first try breathing a little bit more. Breath holding can add pressure down into the pelvic floor. So engage your stomach, your lower abs up and away from the pelvic floor, and make sure you're breathing naturally. Definitely start out on the wall so that you can make sure your technique is good. I see a lot of ladies that if you just ask them to get on the ground and do a push-up and say your career depends on it, they're going to do it. But it's not going to be done correctly in this time frame and is a recipe for challenges. So start with it easy, check it off. If it's too easy, you definitely should move to a lower surface. So the next surface would be a countertop. Maybe you're warming a bottle, just knock out 10 push-ups or do a plank for a little while. It's a great way to sneak some exercise into your super busy day as a new mom. And then once you're done with you feel like it's easy on the countertop, then you could progress all the way down to the floor. This is the same for burpees and mountain climbers. You can actually do those on a tall surface. So you can still follow along exercise videos, and if they're doing something that's all the way on the ground, just see if you can change it to doing the same exercise on a countertop or against the wall. If you love high-intensity interval training exercises and you're not quite ready for the impact portion of that, so the jumping or the quick motions, you should still try those exercises, but do them slowly and don't jump with them. So it's an easy way to modify the exercise but still get your body used to the movements of HIIT exercises. If you see jumping jacks, you can just step out to the side and then return. There's still value in that. If that's too easy, step out quicker. And then once that's too easy, then you could start the jumping activities. And if you are trying to do just kind of a jump straight up, then you can actually raise up to your toes and then lower down and feel your alignment as you're doing that. Feel the support of your pelvic floor as you lift and as you lower. And then you can try lowering quicker, and then you can try actually doing a full jump with a lower and engaging your core that entire time. Here's an example of doing a plank on a fake countertop. So on the left, she's doing a really good job of engaging her core. So her abdomen is engaged, her spine is supported. If you look really closely on the right, her core is not engaged, and we know that because her spine is sagging a little bit. And so she would probably get pain in this position if she were holding this plank and not engaging her core. So the one on the right is not ideal. Always engage your core and make the exercise easy enough in that early postpartum state so that you can actually engage your core. Congratulations, you made it to that 12-week postpartum time frame. This is what some people call the end of your 4th trimester. Your body is really doing great at this point for the most part. You should have less symptoms of urinary incontinence, less symptoms of prolapse just naturally. Your abdomen should feel like it's starting to get a little bit stronger, more engaged. Your pelvic floor should feel like it's getting stronger. Now you're ready to start pushing things and start progressively working your way up to your full fitness potential. So you have all of the information you need. Just go slowly, ease back into it. If it doesn't feel right, reach out to someone who maybe knows how to exercise really well, athletic trainers, peers, and really just trust your body. If you continue to attempt to progress and you're not doing well with it, then make sure to check in with your provider. Let them know your concerns, especially if you're active duty. We want to help to make sure that you're getting back in a good time frame. For our active duty sailors, you actually have 12 months to get back to your full fitness potential, which is really exciting. It used to be 6 months, and so imagine at the 3-month mark, you only have 3 months to scale up to the full intensity that you want. But now you have an additional 6 months from that, so you have a full year to get back. After 6 months, you are eligible for a practice fitness test. And this was fantastic because if you're struggling to get back, then we're able to identify that need and then refer you to the right people so that you have the resources to help you to pass that first fitness test. For those who love weightlifting, there are a few tips that can help you get back to it a little bit better, a little bit faster. So the first key is truly to check your alignment. Even if you were a master of alignment prior to pregnancy, your body is just so different. You want to get back to the basics. Check in with your foundations and have a peer who really has good eyes look at you when you're lifting to make sure that your alignment is spot on now. We have some modification options that we'll go into, and then I really want to discuss what it means to do the correct Valsalva or core activation, lots of terms that get. So the correct Valsalva, some people call creating pressure in the abdomen a bear down. Some call it a Valsalva, some call it a core activation. So we're not going to use words to describe it. I'm going to talk about direction of pressure. So the point of activating your core when weightlifting is to stabilize your spine so you can transfer load appropriately and protect your spine. So to do that, you first want to take a nice big breath, that diaphragmatic breath in, allow your rib cage to expand. That locks pressure in from the top. It's pushing pressure down. Now, if you just start with that and then you push your belly out, you've now stabilized the spine with air. And because your abdomen is overstretched from delivery, you now have a lack of support there. So now that air just has to keep pushing out. It's really going to change your alignment. This is not ideal. So you want to start with that breath, put pressure down, close it out by drawing your lower abdomen up and in. Now you've locked out pressure from the bottom side, and then you're going to fine-tune that with a pelvic floor contraction, and now you're locked and ready to go. Your spine should have excellent stability, your pelvic floor is protected, and your abdomen is protected. So that's the correct Valsalva. We actually have ultrasound studies that have shown that when you do this core activation correctly, like I just described, then you have support of your bladder neck. If, however, you're only pushing pressure from the top down and the bladder neck is a little bit looser from pregnancy, then you're going to have descent or a downward motion of that bladder neck. So let me just repeat that. If you contract from the lower belly and the pelvic floor lifting up to meet the pressure that you're creating from the diaphragm here, and you have this nice tight system, your bladder neck is supported. If, however, you only push down, then your bladder neck is not supported. So when you're lifting weights, make sure you're doing it correctly. Draw up and in, feel the pressure come up and get stuck at the rib cage, not pushing into your pelvis. So some easy modification options. Just change the range of motion. If you feel like you can't keep your alignment well in the beginning, just change what you're up to. So you don't have to squat all the way to the ground, squat to a box, load in the front. If you can't reach behind your shoulder blades right now, you need to work on your shoulder range of motion, which is very common postpartum because you're holding the baby all the time. We're very forward in those early days, so really make sure your shoulder girdle is flexible enough to hold the barbell behind your head again. You can deadlift from higher surfaces if you feel any version of problems with it all the way to the ground. And single leg strength training has been shown to be easier on the spine and actually more effective with muscle mass buildup. So in that early postpartum state, you should definitely consider single leg activities if you're having difficulty with back pain, et cetera, with double leg activities. All right, so you are ready to get back to running. That is fantastic. There are so many benefits to running. Emotionally, it's quite wonderful for a lot of ladies, and physically, there are a lot of great benefits. We just want to be safe with that. So in 2019, a group of physical therapy and gait or running experts got together to discuss what they felt like was the safest time frame to recommend to get back to running. And their general time frame recommendation was 3 months. So you can either think about the time frame and feel good to start returning to run at 3 months after you have a baby, or if you would like to return to running before that, there are some recommendations that we have for you. So I'll just go over this slide. It's pretty detailed. So risk factors for potential issues returning to run. It's just good to be well informed if you're making this decision. So if you are less than 3 months after having a baby, if you're somebody who has a pre-existing hypermobility, so maybe Ehlers-Danlos or any version of connective tissue disorders, if you are breastfeeding, if you have pre-existing pelvic floor problems or lumbopelvic dysfunction, so back pain, SI pain, hip pain, etc. If you have any emotional issues that may cause you to use exercise inappropriately, so kind of use that honest self-assessment. Are you using exercise to aggressively get some energy out? That's something to be very careful about. Obesity, if you had a C-section or significant perineal scarring, or if you aren't getting enough nutrients to meet the demands of exercise. These are all risk factors for problems running prior to 3 months. All right, so let's say that you feel like you don't have very many risk factors and you are ready to get back to running. You've been a runner, you're pretty familiar, your body's pretty familiar with the sensations of running. So here are your tests. First of all, how strong is your pelvic floor? In standing, you need to be able to do 10 Kegels in a row and feel them contract and let go. The second part of the strength test for your pelvic floor is in standing, contracting your pelvic floor and holding it for between 6 and 8 seconds and being able to rest and then repeat that 6 to 8 times. And then the final recommendation is after a break from the other two exercises, you're going to contract and hold your pelvic floor with a gentle contraction, not full force, but a gentle contraction for around 60 seconds. If you can do all 3 of those tests in standing for your pelvic floor, then your pelvic floor is ready to return to running. Now, there are some other considerations. Sometimes because our joints are a little bit loosey-goosey, or maybe you weren't able to exercise as much as you wanted to, your hip joints and your pelvic girdle and pretty much your lower extremity is just weaker than it was before having a baby. So that can change your alignment, which we talked about in the earlier videos. So here are some tests to see how you're able to manage load and if you're ready for running. So first of all, you're asking with each of these tests, do I have any symptoms? Does my pelvic floor feel heavy? Am I leaking urine because of this activity? Do I have any pain? So if you can say no to all of those things with the following items, then you're good to go. So walking for 30 minutes. So you should be able to stand on one leg with a level pelvis. If you look in the mirror and you have a belt on, that's pretty helpful to help see if you can keep that level pelvis, then that belt should stay nice and level. If one hip drops and you see an angle on your belt line, then your hip muscles are not quite strong enough to handle the single leg activity that is running. You should be able to do a single leg squat, 10 reps on each leg, and not feel any symptoms. You should be able to jog on the spot for 1 minute and not feel any symptoms. You should be able to do 10 forward bounds. That's just with 2 feet jumping forward and backwards 10 times without any of the symptoms. And you should be able to hop 10 times in place on each leg without feeling symptoms. So the third and final component of the return to run test is a strength test. So you want to be able to pass these strength tests, again, without any symptoms. So standing on one leg and doing a calf raise, 20 reps each leg. Doing a single leg bridge and keeping your hips or your pelvis level as you raise and lower. Doing the single leg sit to stand, which is the same as the load transfer test, but you're not looking at your alignment, you're really just looking at can you knock out 20 reps. And then lying on your side and lifting your leg up and down 20 times. Now the combination of the strength test, the load transfer test, and the pelvic floor strength test gives us an input or an insight into how ready you are to return to run. We are not saying that you have to pass every single one of these tests, but this is a good way for you to do a self-test to think, if I can't even pass half of these, maybe running's too much for me. Can I build my strength right now? Can I look at my form or the way I'm transferring load a little bit better before I return to run? Should I focus on pelvic floor strength training before I return to run? So if you are unsure, go ahead and check in with a pelvic floor physical therapist. Let them do the assessment for you. But this is just a general rule of thumb for what we recommend you do if you want to return to run before 3 months postpartum. So let's say you've passed this test or you're 3 months postpartum, you are ready to get back into running. My first tip for you is just to make sure you're breathing. The more we hold our breath, the more pressures move down into the pelvis, and that can stress out your pelvic floor. So make sure you have a good natural breathing pattern with your running. You want to focus on strengthening your hips, strengthen your glutes, strengthen your thighs, strengthen your calf muscles. The stronger your muscles are, the better they absorb shock when you're running. Start out slowly and build your tolerance to running. Interval training is a great way to start slow and build up. My favorite recommendation is the Couch to 5K program. You can just look online. There are some good resources for figuring out how to do interval training. You could start out with, for example, 1 minute jog and 4 minute walk and repeat that 4 cycles. And then you change it to maybe a 2 minute jog, 3 minute walk, etc., until you're up to running for the full time frame. Make sure that you have a consistent gradual progression. So let's say that you started out with just running that 1 minute and then walking 4 minutes this week, and then you skip a couple of weeks, and then you say, oh, well, I'm ready for the next level. Well, actually, you needed to do that same thing consistently. So consistent progression is really helpful to prevent injuries and prevent pelvic floor problems. And then cross-train. So if running is not working for you right away, get on the bike, get your cardio going another way, or the elliptical or swimming, just any version of getting your cardio up will help you with your run also. And don't clench, relax your abs. So we don't want to run like this, right? We just want to be able to breathe naturally. Don't put pressures down into your pelvis. So don't contract your abdomen that entire time. And also your pelvic floor should be relaxed. You should not be kegling the entire time that you're running. Minimize downhill running in the beginning when you're first getting back to things. There's just a lot more impact that happens with downhill running. And then generally speaking, you could try shortening your stride length. So if you are running and you hear every foot really heavy on the ground, one of the tips that we recommend is trying to turn your feet over just a little bit faster, so you're shortening your stride length, and usually that helps you to land softer. When you have a softer landing, it usually means that you don't have as much impact into that pelvic floor. So shortening your stride length is one potential tip. And then make sure that you cool down after you run. We want to slowly get your heart rate back to normal, and then you should stretch afterwards. And for some ladies that are still experiencing urinary incontinence, usually you're going to be referred to pelvic PT, and if that's not working, there are other options available. There's something called a pessary, which is a brace-like structure. It's going inside the vaginal canal, and it can help hold the prolapsed tissue in place, and that can stop leaking. So there definitely are ladies who are capable of running as long as they have a pessary in place. And then other support garments, maybe a sacroiliac joint belt to help stabilize your pelvis while you're returning to run. That can allow you to run and to strengthen the hip girdle muscles, which will help to keep those bones in place better afterwards. If you want to run with a stroller, there are some important considerations. The first consideration is really for the baby. So the baby is supposed to be between 6 and 9 months old to protect their neck and spine. That's a really important recommendation. And they need to have a 5-point harness for the baby, fixed front wheels, hand-operated brakes so that you can really easily stop the stroller if needed, rear wheel suspension so that the stroller is absorbing shock, and pneumatic tires, and 3 wheels and a wrist strap. So the wrist strap is there so that if the stroller gets away from you, you can quickly get it back to you. Those are really important considerations. And then considerations for you. We know that you're just going to be a little bit stiffer if you're running with a stroller. It's not a big deal. You can just add extra stretches in there. Rotate your thoracic spine, stretch your hips out like a pigeon stretch. Just work in some flexibility training. And then it's also great to add in extra gluteal strength exercises. So glute max exercises are really helpful. You're not hitting those quite as normally with a run when you have a stroller in place. And we do know that two-handed stroller pushing is more similar to our normal run pattern than a one hand. So sometimes we think maybe it's better to have one hand on so you can keep the other one freely flowing, but the gait pattern actually looks the most normal with 2 hands on the stroller. So when should you request a referral to pelvic floor PT? If you are experiencing any of those common problems that we talked about, if you feel your abdomen is just not coming back despite really making strong efforts, if you're leaking urine, if you have pelvic floor heaviness or vaginal heaviness that you really can't control or it's affecting your activities, if you have any version of pain, these are all good reasons to talk to your provider. That could be your primary care provider, it could be your midwife, it could be your OBGYN. Just talk to them and ask them if it's appropriate for you to have pelvic floor PT. So what is pelvic floor PT? So pelvic floor physical therapists are specially trained in everything that connects to the pelvic floor and of course the pelvic floor itself. So when you go and see a pelvic floor therapist, they're going to look at your full body strength, kind of like that return to run test. They're going to look at how you transfer load. They're going to look at your abdomen, assess for the diastasis recti, assess for how you connect or contract all of your muscles. And they're also going to do a pelvic floor examination. So if it's appropriate for you, if you have pelvic floor problems, they are experts at assessing the pelvic floor muscles themselves. And the whole goal of the examination is to figure out what is contributing to your symptoms. All right, you have completed this pregnancy and postpartum series, and you are well informed on what you should do to decrease the risk factors or help challenges with common pelvic floor problems and abdominal problems. If you have any specific concerns, you can go back to specific points throughout this presentation, re-watch them. There are a lot of points that can go pretty quickly. If you continue to have problems, you know how to reach out to your primary care doctor or your OBGYN or your midwife to request further treatments. You've got this. Take all of this information, and I hope you feel really confident getting out there and exercising and meeting your fitness and health goals.